When you're assessing your patient's lower back, you want to look at the whole thing as one system. So what we're going to look at is how arched the lower back is when they're standing, because you want to be able to correct that as you're doing your adjustments. So with Dina here, she's got a little bit of an arch in her lower back. It's a little hyperlordosis, so pushing it further forward is going to be counterproductive to what we're doing when we're assessing and correcting posture. So what we're going to do for her is we're actually going to be doing a flexion adjustment, which is going to create a little more flatness in her lower back so that she takes all the pressure off those posterior facets, as well as starts to create this beautiful core. It's going to be a corset of muscle tissue that's going to hold her spine apart so it feels much better. Now, if she happened to be tipped forward or had a very flat back, then pushing it forward would make sense. So if it's hyperlordosis, which is the increased curve in her lower back, we're going to do a flexion adjustment, which I'm going to teach you guys in just a minute, where we're actually pulling the joints apart. Or we're going to do a kick move, which is then going to just do a little bit of a flick to rotate the lumbar spine and get it moving a little bit better without creating more P to A motion, okay? But if her back is flat, so you need to assess your patient and figure out whether their back is flat or if it's hyperlordotic. If their back is flat, then we are going to do that traditional P to A chiropractic adjustment where you're pushing the spine further forward to create more of a curve in the lumbar spine. And I'll teach you both of those.